Nacho, thank you so much for having me, and welcome to all your visitors that have joined us on this Saturday evening.
Thank you. Thank you. I understand you're a busy woman and traveling. I think last time I spoke to you, you were just coming in from New York. So, busy woman. So awesome. Thank you. And thank you for the privilege to be on here today. So,
And no, likewise, it's I mean, isn't that the state of everybody? Is we have busy lives, and it leads to a busy brain. And I know we're
yes.
going to get into that, but it's almost become cliche to say I'm busy or I'm stressed, and
Right.
it seems to be the new normal. And if
Yes.
you and I can do one thing for the listeners tonight, it's Saturday evening, or they maybe listen to the recording a little later. Let's kind of rewire the brains from very busy to a calm mindset.
Absolutely. Absolutely. Now, I understand. Do you have Seattle ties? Do you have local roots here?
I do. Well, let's just really the background and my love for the people of Seattle, and is that when I did get diagnosed with a very rare medical condition, achalasia, and it needed surgery, it was very urgent, life-threatening. I had the honor to be operated and healed on by the cardiothoracic team at University of Washington in Seattle.
Wow.
So I, have just a special tie there. And every time I was there for pre-op and my surgery and post-op following with my family, I just the warmth and the love of the people of Seattle, it's something I think my family and I will never forget.
Wow. Yeah. And I think that's how I discovered this mindfulness, right? I think this came about because of that situation.
Yeah. You know what happened? Yes, I never paid attention. I grew up in a household where prayer and meditation were
Mhm.
a part of life, and natural healing remedies from the South Asian subcontinent. And you become immersed in your Western medicine here in the United States, and I started to dismiss all that. And when I was back home with my parents, healing after surgery, and all my aunties around, I went back to that, and I remember sitting in stillness and meditation, prayer in that mindful place, and it began to alleviate my chest pain and didn't need the post-op pain medication. And I started to do yoga, and it was lifting me out of that dark place. And I realized that there is something more here than I've been exposed to as a traditionally trained Western doctor, and that sent me on a journey around the world.
Wow. That's amazing. I kind of myself, I've kind of been awakened as well. And I just been learning more about the mind and the power of the mind. And,
Yeah.
on the way up here, I was thinking of the movie Doctor Strange. Not sure if you've seen it, but there's a couple scenes where it's all in the mind. They talk about the yin, your chi, and just the power in the mind. It's just amazing. And, I just wanted to talk about, like you said, we're in a busy world. We're always up and about doing something. And, the stress level. Been looking at some of these stats, and the stress level. Literally, it will kill you. Can you just
Yeah.
comment a little bit more about the stresses in our life and how that's personally affecting our health?
Yeah, this is something that, as I mentioned at the top of the hour with you, Nacho, is that people feel that their normal state must be extremely busy and stressed. And if they have a moment of calm, they're not working hard enough or achieving enough in life. And we allow ourselves, myself included, to become stressed out by external circumstances, whether we're performing at a job, whether we're happy in a relationship, but our bills and our money. And that creates significant chemical changes in our brain and in our mind and consciousness, and deteriorates our physical health. And this is, based in solid science, that, this is a foundation of healing that Eastern medicine has known for centuries, known as the mind-body connection in Western medicine. And what we know this translates is the Center for Disease Control, the CDC, has done studies, and they show that about 75 to 90% of doctors' office visits, outpatient, are due to stress-related illnesses. So if we managed our stress, we'd be a lot more healthy. And I know that firsthand, not only as a doctor, but even as a patient.
I don't know, did we lose you there? Okay.
Yes,
Okay.
I'm here.
No, I was going to say, on this stress statistics, I was looking at some of these stats, and, I pulled these off the staticbrain.com, and I was, surprised and shocked, but not really, to find that health and poor nutrition, actually on the top five, health was the third on the stat, and poor nutrition was the fifth, the top five of this deal.
Mm-hmm.
And, I'm not surprised, right? The health crisis, terminal illness, chronic illnesses, it's just, I'm overwhelmed. I can't even imagine that something as little as like stress.
The foundation is this response. And so when our mood is off, it creates these chemical changes in our brain, known as the stress response. This is something Dr. Walter Cannon coined back in the 1940s at Harvard Medical School and won the Nobel Prize in Medicine. And as research has evolved over the next 80 years almost, we know that now when we have the stress response in the brain, it affects what I call the airport traffic control center of the brain, the amygdala. Okay. And this area, the autonomic nervous system, is wired to all of the organs in our body. So when we are stressed out, it's no surprise that people have high blood pressure, poor digestion, like irritable bowel syndrome, migraine headaches. I mean, just the list goes on. And, you know, I know the main topic of the show is this heals cancer. There's direct studies correlating that when people are in states of high emotional and physical stress, their prognosis dealing with any type of cancer is even worse. And so the key is how, in a time of a scary diagnosis of a chronic disease, cancer, do we find a way to connect to this present-centered awareness, this place of calm, to allow the mind to calm down and promote healing in the body.
You know, you also mentioned, healing the mind. Last week we had an individual, a Vietnam veteran, who actually came down with throat cancer, and he acquired, this kind of developed when he was in Vietnam, and he, started with Agent Orange,
Yeah. Oh, my goodness.
And there's, today's wars right now, a lot of veterans are experiencing PTSD, the trauma. And not only that, but, just everyday trauma out here, sexual trauma, there's civilians get it just as much as veterans, but how can we how can we train our body, our mind to take back our health, right? To just kind of start eating at the stress and meditation and start kind of convincing ourselves that really most of this is kind of manifested in our heads. And if we can harness the tools, right, to actually start combating this, how can a veteran like myself start start battling the symptoms of PTSD?
Yeah. Okay. So I think I heard several questions in that statement, Nacho, and very profound. So first, I want to take a moment to
and I should say, absolutely, and I should also say, I have ADHD, and we should probably tackle that one too. So
that's okay. It's all love, no judgment here. And I know you have a brilliant mind, and you have a lot of things going through of how we can have a meaningful discussion. I wanted to take a moment to first and foremost honor all the military veterans that may be listening that have served our country. And
yes,
I feel very sad for the VA veterans of the Vietnam War and the Gulf War, where maybe PTSD was not understood. And only now are we beginning to understand the ramifications it has on the health of an individual's mind, body, and spirit. So I wanted to correct one thing you said, and that maybe we can optimize that statement a little better, that it's in our heads, and if that we can heal our heads. There's different diseases of the body, and that comes from inflammation. And inflammation has so many causes, whether it's exposures to toxins or poor nutrition or hormonal imbalances. So, the disease is not, quote, in our heads. So somebody did not get cancer because something is wrong in their head. Okay. The idea is, how can we train our mindset and our emotional resilience to nurture an environment to heal our mind and spirit, and resulting in helping facilitate healing in the body. That's the true answer. And the one answer to that universal is meditation. One of my healing mantras in bringing both Western medicine and Eastern spirituality together is that meditation is medicine for the mind.
Awesome.
I love that. Meditation is medicine for the mind. It's a dose I take every day, sometimes twice a day. And if listeners were listening to one thing here, I know personally, just as a patient, as someone that was burnt out of my career and feeling anxious and having chest pain after surgery, meditation is truly medicine for the mind and healing for the spirit.
That's awesome. Thank you so much for that correction. I love that. This is why I learn. This is why we all learn, right? And I agree. And I just personally started taking a meditation myself. Actually, this is my second week. I started meditation, and I find that very beneficial. Now, regarding meditation.
How has it been helping you in 2 weeks? I would love for you to expand on that to the
Yes,
listeners so that they
absolutely.
know, because they've heard me say, like, right away I was noticing less chest pain and the anxiety was lifting. How has it
Hmm.
helped you?
So, I first went in there. I mean, first of all, I went in there with a kind of awakened mind, thinking, you know what? First of all, like I said, I didn't go in there thinking this isn't going to work or any negative thoughts. I went in there with an open mindset, thinking, you know what? This has to work. These people here are just here in peace, and maybe there's something to a group session. Maybe I'm not doing this right, or is there an instruction book on this thing? So instantly, when I had someone read or do a countdown and just mentally picture like a forest in my mind. Say, hey, you're by yourself. You're walking down this forest, and he painted me a very beautiful picture, and it worked. And it just kind of brought this busyness. My cell phone's blowing up on me, and going here, going there, and meetings, and I just simply put that all to rest. And just for that moment, I felt at peace. And I don't recall the rest of that because I kind of passed out.
Good. Excellent.
Until he called me.
Yeah, it's not passing out. So let's not alarm our listeners. It's not passing out. I call it ascending to a different level of consciousness.
Yes.
So we're turning off that busy brain. We're turning off all the thoughts and the emotions. And it's okay if we don't get there in every meditation.
Yes.
But yeah, the key is, and what you're saying is really profound. It's how I first started meditating, was listening to guided meditations until I've had the blessing to study several different meditation paths, and I found the one that was spiritually spoke to me, and I use a mantra. And so for people who do have ADHD, anxiety, a rush of emotions, repeating a phrase or a word over and over, which is known as a mantra, it is a very powerful way to meditate. And the brain studies actually show that when we meditate, repeating a phrase or a word over and over again for 20 minutes a day for 4 to 6 weeks, we actually start to rewire the brain so that it's healthy and it's not feeling so frazzled and anxious.
Yeah, that's awesome. Like I said, I just now started learning so much about that. And you're right. I mean, for someone like myself, I mean, I actually self-diagnosed myself. I hate going to this WebMD crap. I know that. But, I knew that I'm one of those people who is always go, go, go. And I thrive. I thrive on the pressure, just coming to someone's rescue. Type A. I mean, maybe that's why I joined the military, but I love helping and coming to the help of others, and it's like my own form of drug, right? That rush of just doing some good for humanity. I love that.
Yes, being of service. It is. It's absolutely. It's an excellent and a healthy dopamine rush. But the thing we don't have to do is sacrifice our own health in that, way. There's a balance, because in order to be of service to others, we have to be full energetically ourselves. That idea in the mindfulness known as self-compassion, or what's been translated in Western psychology in the concept of self-care. And
so true.
Really overcoming that, we need those rituals every day, whatever it is that will calm us down. And here's a technique I wanted to give you, not sure if it's okay, and I find it works with a lot of my clients. People, you're not alone in getting on WebMD or Dr. Google and figuring out, oh my gosh, I must have ADHD.
Okay, good.
Our brains have just become rewired in our culture because of our text phones. Our phones are always blowing up with texts and notifications, and we're on email and trying to talk to people at the same time, and it creates a difficulty focusing, a part of the busy brain that I call it. And one of the things I have people do is to stop everything, put everything down, turn everything off, and for 3 minutes do a controlled breathing exercise. And as you're doing that, think of all the things that are coming to you on your to-do list, your emotions, your stories, as all open windows. And, so everything, me doing this radio interview tonight, making a guest appearance at another event tonight is a different open window. What am I going to wear is a different open window. Everything that's going on is an open window, and you just imagine yourself closing every window. And, when you need to refocus, it's what window am I going to open right now? And so the window I'm opening right now is this present-centered awareness with you and all of your listeners.
Wow. That was awesome. I love that. And I will definitely work on that because, like I said, this, mantra, like you said, saying things, repeating things, and believing, in what you're saying and what you're saying, putting out in the universe is so powerful. And thank you for that reminder, And that's, like you mentioned earlier, right? This heals cancer. I know it was kind of a play on words, and a lot of people have said to me, what is it? What heals cancer? And I always, I and I honestly believe this when I said, well, I got the cure to cancer. And they say, well, what is it? I said, it's love. And they gave me this puzzled look. And I said, look, it's love for yourself. Learn to love yourself for how you are and who you are. Once you kind of do that, you'll start spreading that word and just start feeling the abundance of life. And you realize that life is precious. And, that, like I said, it's part of the meditation. And I use breathing, right? I love it. I know I have the app. I'm not sure about you guys are wearing the iPhone, right? But if you have that app, that Breathe app, it does kind of vibrate every now and then. It is a great reminder. It tells us, hey, just stop for a second and breathe. And that's a great comment on that. So thank you. For anybody who maybe is going through cancer, and has this mindset like, I don't know, I don't believe in myself. Can I do this? I had a dear friend who's right off the bat, when he got diagnosed with cancer, he just said, "Oh, I got this. Too easy, I'm gonna attack it." And it was the mindset that he came to this that has helped him. What would you say to a cancer patient who just recently got diagnosed? And I personally believing in hope. Hope is what we got. What could you tell someone that just recently got diagnosed with cancer?
Nacho, your statements are so beautiful. It reminds me of the saying in A Course in Miracles that a miracle is a shift in perception from fear to love. And when anyone is diagnosed with a disease, a new chronic disease, it is absolutely normal to feel a level of fear, especially when we hear it's the big C, cancer. To know that if in the moment you are having negativity and doubt and fear, it's a normal emotion. But the longer we fight these negative emotions, the fear, rather than naming it and sitting with it, the longer it persists. And so what I really honor the concepts of mindfulness-based cognitive therapy, it's not about ignoring your emotions and how you're feeling, but bringing them to the forefront, naming them and processing them and let them going through you. So not only is it effective with fear and anxiety that can come around a diagnosis of cancer, but same for the PTSD patients where, other medications are numbing the symptoms of PTSD. Mindfulness-based cognitive therapy makes you bring those images and feelings and thoughts and emotions to the forefront and process them. So to go back to your question about cancer patients, is first of all, be here now. And if in this moment you are feeling fear or lack of hope, it's a normal process. The key is now saying, well, what am I going to do about this next? And, the one thing I know personally, having gone through as a doctor of a very serious health scare, was in that moment of darkness where I was full of fear and I lost hope, is identify what I call 3 hope holders in your life. These are the people who are not going to get on Google and tell you what to do and be like, oh, girl, I heard you need to snort that essential oil or you need to try this chemotherapy or go see that doctor. Those are the people who mean well and they're trying to help. But a hope holder is this, that they are there to listen to you when you have fear or joy, and they recite this mantra for you. I love you, I believe in you and your healing, and you got this. And their job is in their heart to hold the light of hope. It was something I learned not as a doctor, but as a patient. And I was so blessed that it started with my own mother and father being my hope holders and my surgeon there at University of Washington in Seattle, and the effect just multiplying to family friends of every religious community you can imagine. And that was such a powerful force in my healing to know that in the moment when I didn't have hope, others did that. And so one of the things I always offer to my clients is being their hope holder now. That, in my time of need, someone was holding hope for me, and it's how can I hold hope for others? And Nacho, you certainly do that on your radio show. So anybody needs to hear it now. Let's tell them together, I love you, I believe in you, and you got this.
That is amazing. That is awesome. Thank you so much, Dr. Romie. That's powerful, and I'll be sure to link this this segment on the website, and I'll gladly link it to yours as well. I know you're a busy woman and you got to go. So before you do, you want to talk to us about your upcoming book and when that's gonna.
Yes, I'm very excited, Nacho. Thank you. We are currently working on my first of 3 books. It's The Busy Brain Cure, Taming the Crazy Mind, Stopping Anxiety, and Finally Falling Asleep. And in this, I bring together the concepts of Western medicine and Eastern spirituality and integrative medicine, and let's get to the root cause. That ADHD, difficulty focusing, anxiety, sleep, they're actually all due to a very common root cause of inflammation and the stress response in the brain. So we're going to walk people through a 21-day program that's based in science but all holistic to get to the bottom of why those neurotransmitter abnormalities are happening, to heal it, and to work through a process that, involves divorcing our digital devices and, bringing mindfulness and meditation practices in and really healing the mind, body, and spirit, because being calm is our birthright. Choosing to be busy and stressed is just, I think, a falsehood that we've been wired to believe in this culture. And, I'm human. I get busy and feel overwhelmed at times too, and I know you do too, Nacho. But really, if we could always center back to remembering that our internally, our barometer and our spirit and our mind is set at calm. And if we can do what we can to find that place of calm every day, we then start to shift from that place of fear to love.
Wow, amazing. I can't wait to get my hands on that book because, I fall in that category. I could be a guinea pig for this thing, absolutely. So, Dr. Romie,
You're not alone, Nacho. I speak to highly successful professionals in corporate America, and every week, and you're not alone. And so, if anybody's listening, they're not alone. I will make sure and send you a copy when it comes out next year. And to all your listeners, we love you, we believe in you, and you got this. And
thank you.
Anybody that's out there dealing with cancer tonight, may we hold the intention that you find the light of hope and love.
Thank you. Such blessings. How can we get a hold of you?
Yes, drromie.com is the website, DRROMIE. And if you and any of the listeners are listening live or to the recording later, always drop me a message on Twitter or Facebook at drromie.com, and I'll answer you right back.
Perfect. Awesome. Thank you so much. And I will create a link on our website as well, thishealscancer.com. So, Dr. Romie, thank you so much for your time, and I look forward to speaking to you again.
Likewise, Nacho. Thank you.
Thank you.
Be the love in the world. Take care.
Peace.
Bye-bye.
Okay, we'll go to here a quick break, and we'll come right back.
Nothing can stop me. I'm all the way up.